Good afternoon, dear students. We will continue the course of lectures on the discipline medical rehabilitation for stomatologists. Please, we will connect in the chat who will be in the chat, who will invite me on the chat lecture. We will fixate as present on lecture. Please, I wait you. Okay. Dear students, the topic to the lecture is medical physical culture in the treatment and rehabilitation of the patients with fractures, reconstructive plastic surgeries of the maxillofacial region. You can see on this picture the ancient physician Hippocrates. He was Greek. It describes the clinic manifestation on the fracture of maxillofacial regions. Written in 460 years before Christ. Displaced but incomplete fracture of the mandibular, where continuity of the bone is preserved, should be reduced by pressing the lingual surface with the fingers, while contrapressure is applied from the outside. Following the reduction, teeth adjacent to the fracture are fastened to one another using gold wire. Damage of the maxillofacial regions due to the occurrence of the mechanical, chemical, and combined disease. What is causes of maxillofacial trauma? Home accident, MVA, athletic injuries, animal bites, violence, industrial accident. Where mandibular is one of the most commonly fractured bones of the face, and this directly related to its appointment and exposed position. Studied 729 patients with multiple injuries sustained of RTA. The most common facial fracture were in mandibular, 61%, maxilla, 46%, zygoma, 27%, nasal bone, 90%. In this picture, you can see illustration the epidemiology of fracture of the maxillofacial region. Fractures falling onto a face from a significant height, gunshot wounds to the face, motor vehicular accident, blow to the face, weakening of the jaw caused by severe gum disease, periodontal disease, erosion of the jaw bones, all meat diet, supplementations with improper ratio of calcium in the phosphorus, chronic kidney disease, osteogenesis imperfecta, congenital disease, cancer of the jawbone. It's the most often reasons of fracture. Pathophysiology. Fractures result secondary to mechanical overload. Toe were result of spiral fractures, avulsion in transverse fractures, bending in short oblique fractures, compression in impaction and comminution. How about classification of fracture? Simple fracture. A simple fracture is a break in the bone that does not produce an open wound in the skin. Complete or incomplete. Tissue adjacent to the fracture may or may not suffer considerable injury, also known as closed fracture. Multiply. Two or more fracture lines that are not connected to each other. Indirect. The fracture site is distant from the site of injury. Complex. There are considerable. Soft tissue injuries, this may be simple or compound fracture. Comminuted involves splintered or crushed bone. Green stick, also called incomplete fracture. One cortex of the bone is broken and the other cortex is bent. Atrophic, fracture resulting from severe atrophy of bone. In this picture, you can illustrations some variants of fractures. Simple fracture from left to right, green stick fracture, compound fracture, simple comminuted, and compound comminuted. Its variant of mandibular fracture can occur in the body, symphysis, condylar, subcondylar, coronoid process, ramus body angle. You can see the epidemiology types of fracture of mandibula. In this picture, you can see the most often place where occur fracture is body and condyle. In body in the angle. The most often it's condyle process suffer from fracture. This picture you can see illustration same. It's fracture destruction and variability. You can see some manifestation of fracture maxillofacial region. It's discoloration of eye, deformity, facial borders, loose, missing, or improperly elignate teeth, swollen jaw. For diagnostic, the image of maxillofacial region use physical exam. Change in the occlusion in highly diagnostic. Anterior open bite suggestive bilateral condylar or angle of fracture. Posterior open bite common with alveolar process of parasymphyseal fracture. Unlateral open bite with ipsilateral angle of parasymphyseal fracture. Retrognatic angle 3 seen with condylar or angle fracture. Prognatic angle second seen with TMG effusion. Anesthesia of lower lip, pathognomic of a fracture distal to the mandibular foramen. The converse is not true. Not all fractures distal to the mandibular foramen have mental nurse anesthesia. Trismus of less than 35 millimeters, also highly suggestive of mandibular fracture. Palpation. The mandibular should be palpated with both hands, with the thumb on the teeth and the fingers on the lower border of the mandible. Slowly and carefully place pressure, noting the characteristic crepitation of the fracture. Inability to open the mandibular suggests impingement of the coronoid process on the zygomatic arch. Inability to close the mandibular suggests a fracture of the alveolar process, angle ramus, or symphysis. Pertinent physical findings are limited to the injured side. Change in occlusion may be evident on physical examination. Highly suggestive of mandibular fracture. Ask patient to compare post-injury and pre-injury occlusion. Maxillary advancement with leaf third for correction of the maxillary deficiency. Its mandibular sit back for with corrections of prognatism and asymmetry. Laceration and ecchymosis. Mandibular fracture can often be directly visualized beneath facial lacerations. Laceration should be closed after definitive therapy of fracture. Ecchymosis is diagnostic of symphyseal fracture. Post-traumatic premature posterior dental contact, anterior open bite, and retrognatic occlusion may result from a mandibular angle fracture. Unilateral open bite deformity is associated with the unilateral angle fracture. Anesthesia, paresthesia, or dysesthesia of the lower lip may be evident. Intraoral hard tissue injuries also can be manifestations of maxillary fracture, mandibular fracture. Change in facial contour, loss of external mandibular form may indicate mandibular fracture. An angle fracture may cause the lateral aspect of face to appear flattened. In the correct diagnostic, help to match radiographic exam. Panorex shows the entire mandibula but requires the patient to the upright. It also has particularly poor detail of the TMAG and medial displacement of condyles. AP ramus and condyle. Submental symphysis. CT condylar fracture. It's example of radiographic examination, X-ray examination. Imaging studies. The single most informative radiological study used in diagnosing mandibular fracture is the panoramic radiograph. Panorex provides the ability to view the entire mandible and in one radiograph. Panorex requires an upright patients and it lacks fine detail in the TMAG, symphysis, and dental alveolar process regions. Plain films, including lateral oblique, occlusal, posterior anterior, and periapical views may be helpful. The lateral oblique view helps in the diagnosing ramus angle or posterior body fracture. The condyle, bicuspid, and symphysis regions often are unclear. Mandibular occlusal views show discrepancies in the medial and lateral position of the body fractures. Caldwell posterior views demonstrate a medial or lateral displacement of ramus angle body or symphysis fracture. CT scanning may also be helpful. CT scanning allows physicians to survive for facial fracture in the areas, including the frontal bone, nasal-ethmoidal orbital complex, orbits, and the entire craniofacial horizontal and vertical buttress systems. Reconstructions of the facial skeleton is often helpful to conceptualize the injury. CT scanning is also ideal for condylar fracture, which are difficult to visualize. You can see example radiographic examination, how help diagnostic damage or of maxillofacial region patient. It's panoramic radiograph 12 weeks after concallus iliac graft and the reconstruction plate showing bone union. Its radiographic investigation help in the control correct treatment, the osteosynthesis of patients with fracture of mandibular maxilla. It's also some example radiographic. How about complication of patient? Socioeconomic groups, infection, delayed healing and malnutrition, most commonly caused by infection and non-complex. Neuroparesthesia in less than 2%. General principles of treatment. The general physical status should be thoroughly evaluated. 40% associated with significant injury, 10% of which are lethal. Cerebral contusion is common. ABCs, almost nerve emergent. How about general principle of treatment? Dental injuries should be treated concurrently. Reestablishment of occlusion is the primary goal. Fractured teeth may jeopardize occlusion. Mandibular cuspids are cornerstone of TX. Prophylactic antibiotics. With multiple facial fracture, mandibular fracture are treated first. You can see the ideal lines for osteosynthesis. Masticatory muscles produce tension at upper border and compression to lower border. Torsional forces produce anterior to the canius. Champion. Monocortical tension bending. Osteosynthesis neutralized distractions and torsion during physiological stress, while normal better compression of restorate. Dynamic compression. Compression resulting in preload and friction. Preload prevents distraction. Friction resists torsional forces. Close results only underneath plate. Jape opposite side. Allows for primary healing. Contraindicated in comminution. You can see how provide osteosynthesis for persons with symphysis and paraphyseal fractures. Transverse fracture without dislocation. Its symphysis a symphyseal fracture. It's basal triangle comminuted. It's osteosynthesis for body fracture without dislocation first from left to right and with dislocation. It's variant of osteosynthesis comminuted body fractures, mandibular body fractures. Angle fractures without dislocation. Rapid I and if. Advantages: easy insertion or time 10 minutes. Remove without anesthesia. Minimal dangers of surgeon. Decrease damage to dental papilla and oral mucosa. Easier to maintain dental hygiene. Compatible with all rigid plating system. Disadvantages: rapid IMF. Dental root injuries, loss of tension band, directional traction. It's grafted right mandibular body non-union with cancellous iliac crest bone graft, packed into polyglactin mesh tube. It graft left mandibular body non-union with cancellous iliac crest bone graft packed into polyglactin mesh tube. Objectives. For effectiveness, its anatomy, fracture distractions, principle of rigid internal fixation, AO method, rapid IMF, etc. After operation and consolidation of fractures of bone, maxillofacial region, we can see some phase of bone healing. It's reactive phase. fracture and formation of granulation tissue. Reparative phase, replacement of granulation tissue by callus, connective tissues plus cartilage. Replacement of callus bone by lamellar bone. And next, it's remodeling phase, remodeling of bone to normal contour. Dear students, all this information about fracture, what is fracture, how about pathogenesis of fracture, diagnostic, treatment, necessary for you for understanding the principle of rehabilitation person after trauma, an operation, because you are present on the second course, but you didn't know about this. But now, indirectly, we will discuss the principle, main task of medical physical culture in the treatment, rehabilitation of the patients with injuries of the maxillofacial regions. First, prevention of respiratory, circulatory, and metabolic disorders. Second, improvement of blood and lymph circulation in the affected area in order to stimulate regeneration processes. Next, preservations of the function of loss of function of mimic and chewing muscles of the uninfected half of the face. And improvement of the psycho-emotional sphere of patient. After trauma, patients have bad mood, very often connect with depressions and high level of axillary irritants patients. It's have bad influence on the process of regeneration and healing fractures of the maxillary region. How about indication to the appointment of medical physical culture for injuries of the maxillofacial regions? The most common cases of exercise therapy for injuries and disease of the maxillofacial region are open and closed fracture of the jaws, contracture of the temporomandibular joint, inflammatory process of soft tissue of the face and dental jaw system, repair and restoration operation, gunshot wounds. Contraindications for the appointment of medical physical culture for injuries of the maxillofacial regions. Absolutely and relatives. The general serious condition of the patient due to high temperature, more than 37.5 degrees of Celsius. The presence of pain aggravated by physical activity. Now, how about pain? Severe pain, only severe pain, can be contraindication for exercise therapy, medical physical culture. Easy, moderate pain, severity of pain, it's not contraindication for exercise therapy. Okay, next contraindication is acute inflammatory process of the soft tissue of the maxillofacial region. Past. Next. Absolutely contraindication. The risk of secondary bleeding due to the displacement of a foreign body, bullets, maybe fragments of bones and other, etc. Located near the vessels. Next, it's insufficiently reliable fastening of fragments of the loaves during splinting. No, also, there are general contraindication for medical physical culture. You know about this. No, I will repeat you. It's when there are malignant tumor, oncology disease, with risk of metastasization of tumor. Also, psychosis. Psychosis is psycho-emotional and motor irritation of patients. Next, it also can be open tuberculosis. Contraindications. And bad condition of person. For example, shock, low blood pressure less than 50 millimeters of mercury systolic, 60, excuse me, 80 millimeters of mercury systolic and 50 millimeters of mercury diastolic blood pressure. And opposite situation, high blood pressure, more than 220 millimeters of mercury systolic, 110 millimeters of mercury diastolic blood pressure. The timing of the start of physical therapy is dependent on the nature of the disease of injury. In the absence of contraindication, medical physical culture is prescribed from the first days in the combination with other therapeutic agents. Classes of therapeutic or physical culture with patients, for patients with injuries maxillofacial region are built according to the period adopted in surgery. However, in the methodology of therapeutic exercise, there are a number of features due to the clinical manifestations of dental disease. All time of rehabilitation, patients with fracture maxillofacial region can divide on the 3 periods. First, introductory or first period of immobilization, as usually is 2 weeks. Main, or another is the second period of immobilizations from the beginning to the 3rd week. And 3rd period is recovery period after the removal of immobilization until the complete restoration of impaired function. Introductory or first period of immobilizations, 2 weeks. The first period is the period of acute manifestation of the pathological process. It is characterized by the development of inflammatory or reactive inflammatory processes in damaged tissue or significant intoxication. The main task of medical physical culture in the treatment rehabilitation of the patient with injuries of the maxillofacial region in the first period of mobilization are: first, improvement of the general condition of the patient, decrease intoxication, bad mood, psycho-emotional stress, improvement of local blood and lymph circulation, stimulations of resorption of post-traumatic infiltration of tissue and hemorrhages in the area of the injured jaw, stimulation of reparative process of primary callus formation, prevention of malnutrition and atrophy of facial muscles, contractures and stiffness in the temporomandibular joint, normalization of nasal breathing, prevention of complications associated with hypokinesia. Hypokinesia and hypodynamia, dear students, it's lack of movements, have many negative effects on the different organs and systems of human body organism. First of all, is cardiovascular system, bone system. What is the result of hypokinesia, dear students? It stimulates function of osteoclasts. Did you remember? What is functions of osteoclast? It's resorption of bones tissue. If person have not enough movements, lack of movements, it have very bad effect on the consolidation, regeneration bones after fracture. Also, hypokinesia have negative effect on the immune system, respiratory system, nerve system, etc. But medical physical culture, exercise therapy prevent hypokinesia, hypodynamia, stimulate more fast, more effective regeneration of bone and improve health of patients. The appointment of medical physical culture for patients with injuries of the maxillofacial region in first period of immobilization. The method of practicing therapeutic exercise provides for an individual selection of general strengthening, breathing, and special exercise against the background of a motor regime and adequate to the patient condition, usually in the third, fourth days after trauma. Treatment of patients is recommended semi-bed rest mode and in the future a free motor mode. Free movement regime. Yes, students, the mode regime, it's synonyms. General strengthening and health improving exercise in dosage, providing increased activity of the cardiorespiratory system, appropriate functional capabilities of the patient. Starting position for performing exercise is lying or sitting in good condition. Most of the exercise supports standing. During this period, it is recommended to carry out exercise for muscles that are not associated with damaged tissues and breathing exercise. Apply those movements of a general nature and local for unaffected muscles indirectly affecting the affected tissues. When performing special exercise, displacement of the associated bone fragments should not be allowed, since violations of immobilization in the cause of the development of complications and an increase in the duration of fracture treatment. Therefore, with double jaw splinting, exercise for chewing muscles are not used in the first period of training. Only a careful sending of impulses to the contractions of the masticatory muscles is allowed with closed dentition. Yes, students, it's exercise, if you remember, we said that have name ideomotor exercise for persons with double jaw splinting. During this period, general strengthening exercise associated with sharp torso tilts and head turns. Jump are also not recommended due to the risk of disruptions, the fixations of damaged bone fragments. With single jaw splinting or osteosynthesis without intermaxillary fixation, patients are allowed carefully movements of the lower jaw in various directions already for second, third days. In this period, exercise for facial muscles of the tongue and neck are widely used, which help to improve local blood circulation and reduce the tone of the masticatory muscles, which are performed while sitting in front of a mirror. Ideomotor and impulse sending exercise are recommended in the combination with breathing exercise. The durations of therapeutic exercise is 10-15 minutes, and additional patients should perform 5-10 special exercise in their own several times a day. Hydrokinesiotherapy, rinsing with disinfectant solutions, is also prescribed after each liquid meal and between meals. In patients with single fracture of the lower jaw with a smooth course of the healing process, on average 8-9 days after double jaw splinting, it is allowed to remove the rubber rings while eating. This circumstance allows patient to make active movements of the lower jaw with closed lips, avoiding pain in the temporomandibular joints. The patient is recommended to perform a series of exercises at each meal, consisting of 4-5 movements of the lower jaw, opening and closing the mouth, lateral and circular movements jaw, repeating 5-10 times each of them. In case of double fracture of the lower jaw that occur without complications, the intermaxillary fixation is removed at the time of eating, 2-4 days later compared to single fracture. Functional loading should also be carried out with greater care and supported by the appointment of an appropriate diet. During osteosynthesis of the lower jaw for 3rd, 4th, 5th days, patients are allowed to perform sparing movements in the temporomandibular joint. Already on the 7th, 8th day, with a smooth course of healing, all the fracture movements in the joints are performed in full. In addition to special exercise, morning hygienic gymnastics, dose walking, climbing stairs, and staying in the fresh air are prescribed. The second period of immobilization. The second period is subacute, characterized by a decrease or disappearance of inflammations and an improvement in the general condition of the patient. The main task of medical physical culture in the treatment rehabilitation of these patients with injuries of the maxillofacial region in the second period of immobilization. Prevent the development of stiffness in the temporomandibular joint. Stimulation to reparative process in the primary callus formation. Prevention of malnutrition and atrophy of facial muscles. Contraction and stiffness in the temporomandibular joint. Combating the development of contraction, restoring the mobility of the temporomandibular joints, as well as the function of various muscle groups. Prepare the patients for discharge from the hospital. Restorations of the functions of mimic and chewing muscles. Adapt to the patient to the household and work loads. The durations of therapeutic exercise in the second period of immobilization, due to the appointment a larger number of general developmental and special exercise. The functional loads on the temporomandibular joints is increased by assigning individual tasks consisting of several special exercises performed by the patients on their own 7 to 10 times during the day. With double jaw splinting, mechanotherapy and passive movements of the lower jaw are not used, as this can lead to the formation of the false joint. In the second period of immobilization, active movements are applied with the help and use of rubber plugs, wedges, active movements for the TMG, exercise for the tongue in case of damage of restored normal speech function. In the classes, exercises are used outside the oral cavity and the pronunciation of vowel sounds, syllables, words. For example, stick out the tongue in the form of a scapula and relax it. Bend the tongue with a hook up, then down. Run the tip of the tongue along the dentition from the outside, etc. After the tongue has reached good mobility, one should proceed to the pronunciation of letters and words in the future Reading aloud and in a sing-song voice is recommended. In this period, also, it is recommended to carry out the following special exercise, against with background to general development and respiratory exercise. Active, free, active with help for the lower jaw with the maximum possible range of motion. Tongue massage of the damaged mucous membranes and the oral cavity itself in order to reduce the formations of road scares. Active movements of the facial muscles and massage of the skin in order to prevent scarring. In the third period of restoration of the function of patients with injuries of the maxillofacial apparatus. The third, or recovery post-immobilization period, it regularly develops a callus when the bone tissue is damaged and ends with scarring or epithelializations, then the soft tissue are damaged. In this period, healing bones, the remodulating of bones tissue must be full recovery. The appointment of medical physical culture for patients with injuries on the maxillofacial apparatus in the third period of restoration. The task of exercise therapy is to restore the impaired functions of the affected organs and the patient's ability to work. Exercise therapy means are used for contractures for the jaws, cicatricial changes in the oral region, damage to the facial nerve, damage to the tongue and muscle fibers. In the third period, a wide selection of special exercise for chewing muscles, active, passive, and with resistance. The use of mechanotherapy, performed with maximum amplitude of movements, even against the background to moderate severe pain, allows you to eliminate the existing limitation on the function of chewing and speech. Хорошо. Ну, будем уже входит, да. До встречи через минут. General hygienic gymnastics includes breathing exercise with active hand movement, exercise for the muscles and joints on the lower extremities, exercise to strengthen the cardiovascular system, exercise for the muscles of neck. In this picture you can illustration general hygienic gymnastic. These can use in the old period rehabilitation patients after trauma. Start from the third, fourth days after trauma if haven't contraindication. You can see some example of exercise with medical physical culture for patients with injuries on the maxillofacial apparatus in the third period of restoration. Exercise for the muscles surrounding the mouth, exercise for the entire group of mimic muscles, exercise for chewing muscles, exercise for the muscles of the tongue, exercise for the muscles in the soft palate, exercise coordinating the act of swallowing, exercise coordinating the act of speech. This approximate set of exercise for therapeutic exercise. It's raising arms to the sides and up, inhale in through the mouth, the closed teeth, Lowering the arms to the sides down, inhale through the mouth, lips and collected and tube muscles are tense for 6 times. Hands forward up to the sides down. Hands on the belt during the head to the left with inhalation of the left corner of the mouth. Hands on the belt, turning on the body by 90 degrees while raising the arms up with the palms inward. Look at the hands. Inhale through the nose. Inhale, inflate the cheeks. Return to the standing position 4 times in each direction. Inhale about nose with eyes closed and lids completely closed. Inhale through the mouth, lips folded into a tube. The muscles surrounding the mouth are tense. The muscles that ride the eyelids and eyebrows are tense. Wrinkles form on the forehead. And other exercise, dear students, you can see these types of exercise. Note, exercise is recommended to be given in the various combination. For example, tilting with arms raised, squatting with arms spread, raised on toes, etc. In all movements, inhale for 2 counts, exhale for 4 counts. You can see different variant of approximate set of exercise. Medical gymnastic. Also very widely used massage. In this picture you can see a variant of medical massage for neck. In the first period of rehabilitation, use exercise for collar zone, neck and collar zone, and the second and third period we can use facial zone for and mandibular zone for massage, but second period it should be very with very small influence, very easy without root movements. In the third period it can be more intensive. Also we should recommend on the third period for patient self-massage. In this picture you can see the direction for massage movements and some technique massage which use
Просто она раньше, поэтому я...
Excuse me, technical problem.
Так, сейчас не выключили, да?